Good afternoon, everyone, and thank you for tuning in. I am Michael Gallant, the Hay Institute's Acting Chief Executive Officer, and I welcome you to the Institute's first virtual panel, Global Pandemic Local Response, Human Security Approaches to COVID-19, which is proudly co-sponsored by the American Association of Suicidology. As you're all witnessing firsthand across the globe, wherever you are, we are in unique and unprecedented times with a life-threatening virus upending our daily routines and threatening our friends and family. Each and every one of us has been touched in some way by the COVID-19 pandemic, but within that, though, comes an opportunity to really dig deep into how we can move forward once this virus has been defeated, by recommending policy actions and outcomes as governments around the globe look to rebuild after social distancing and quarantine protocols end and a vaccine is developed. Without further ado, I would like to introduce you to our first speaker before the panel discussion, Poppy MacDonald, who is the president of USAFacts and serves as the senior advisor to the Hay Institute's leadership team. For those of you who don't know, USAFacts is a nonpartisan, nonprofit civic initiative and a source for well-visualized data on the American people and how we are doing as a nation leading an effort to help Americans ground their democratic debate in facts. Poppy previously served as the president and chief operating officer of Politico USA, National Journal's publisher and president, as well as chief revenue officer, Politico Pro's executive director of business development, overseeing the launch of Politico's first paid subscription model, and as a partner at Gallunt Inc., where she launched the World Poll and led the healthcare practice. She began serving her career working alongside members of Congress, representing her Pacific Northwest hometown, both on the Senate and House sides of Capitol Hill, and is happy to be back, enjoying Seattle, and surrounds herself with her husband and 2 children. Poppy, I lend the microphone to you.
Thank you, Michael, and hello, everyone, and thank you for joining us. I got that great introduction, but I'm Poppy MacDonald, president of USAFacts and a senior advisor to the Hay Institute. The Hay Institute was founded in 2016 with the mission of promoting a human security paradigm toward policymaking and creating a space to unite conversations of human security across sectors. In our programming, we focus on 3 thematic areas: trauma, beneficiary-focused aid, and evidence-informed policymaking through a human security lens. The Roundtable Project is one of our featured initiatives, which has held events on Capitol Hill in the past year. This is our first virtual panel, hoping to reach all of you isolated at home due to the new coronavirus. To learn more, or if you'd like to get more involved with our work, which we hope you do, please make sure to check out our website, thehayinstitute.org, and follow our Twitter page to stay up to date at the handle @HayInstitute. While we are discussing different impacts of the new pandemic, governments, international organizations, civil society, the private sector, and the public continue to respond to this new challenge. Applying comprehensive and multidimensional human security-centric approaches remains critical to mitigate the spread of this disease and to reduce the global mortality rates. We at the Hay Institute urge governments to collaborate responsibly. Partisanship and geopolitical feuds should have no place in battling international public health risks. As we take necessary precautions, we need to avoid fear and overreaction, to be mindful of the most vulnerable populations who cannot take safety measures without assistance. We urge the various sectors involved to avoid contributing to spreading any misinformation or encouraging non-compliance with legitimate public health directives during this critical time. Human security approaches offer a promising way forward at a global scale and in our local communities. Our panel today explores how these levels are connected and how the human security paradigm can help us face the pandemic. We call for unity domestically and globally, avoiding blame games and directing all resources to fight and prevent this disease. Partisanship, misinformation, non-compliance, blame. Now is not the time for that. Now is the time to put aside our differences, our agendas, and unite in productive conversations about what we can do together to face this pandemic on a domestic and global scale. These conversations start with the facts, which is what I'm honored to be here to talk to you all about today. USAFacts exists because we believe facts deserve to be heard. Facts are the foundation of productive conversations and data-driven decisions about human security. In 2016, our founder, Steve Ballmer, was trying to understand what he could do to help lift kids out of poverty. To determine the best place to make an impact, he wanted first to understand the gaps in the United States government's own efforts, what government does with the money it raises, and who it helps. With his business background, Steve searched for solid, reliable, impartial numbers to get an accurate picture and to make data-informed decisions. He asked a few financial analysts to go look for that data from government. They thought it would take them 2 weeks to get the data. It ended up taking 6 months. That was the light bulb moment. Steve wanted to find a way to make it less difficult for citizens who are shareholders in their country to get access to the data that helps them understand the status of the country and where they can be advocates for change. So Steve assembled a small team of analysts, writers, and researchers and started to look for and provide government data to the public. After all, everyone pays taxes for these government programs and services. They too should see how their money is spent, whether they're for their own personal knowledge or as a starting point for advocacy. That is the result of and how we are today at USAFacts. We are a not-for-profit, nonpartisan civic initiative providing the most comprehensible and understandable source of US government data available. We standardize the data across 70 federal agencies and present it in plain language with helpful visualizations so you can understand the trends in US spending, revenue, population and demographics, and policy outcomes. We do all of this to give Americans the tool to ground public debates in facts. Serious, reasoned, and informed debate on the purpose and functions of government is vital to our democracy. Fast forward to today, that word vital means something very different now than it did just months ago. We're in the middle of a global crisis, and access to the facts may be more critical than ever. Day to day, having transparent, accurate, real-time access to data is important. During a global health crisis, it can be life-saving. People all over the world are trying to make life or death decisions, and they need accurate, timely data in order to do that. For people trying to make real-time decisions about hot zones or areas in crisis, having the most up-to-date information is critical. But that data is hard to find and even harder to interpret. This matters for the US and the world. Today, that means USAFacts is doing our part to respond to the coronavirus epidemic by tracking down real-time data at a county level. It's important for you to understand the level of effort involved in a world where there is no standardization in the US for how data is transparently reported. Today, I'll talk specifically about the lack of access to data in America. But make no mistake, this is not just an American issue. It's a global issue. We hope that the models we're developing will provide a foundation for the US government bodies to standardize their data collection and reporting, and that eventually the US government will be an example for other governments around the world so we can provide more security to people in need. Right now, the people who need the information in order to make life or death decisions don't have access. Government agencies don't always talk to each other. Counties aren't reliably reporting data to states or putting it in an electronic format that's easily transmitted to the federal government. The pipeline of data from local to state to federal isn't rolling up quickly or effectively. For example, you can find information about how many hospital beds or ventilators are available. The most recent data is from 2018. That's a problem for a health crisis in 2020. So we set out to solve the problem, to gather real-time data that can have a real-time impact. It's taken an incredible amount of effort for USAFacts to find the information. On a daily basis, our small but mighty team manually checks state-level websites for confirmed cases and mortality rates at the county level, and supplements state-level sources by consulting county and local-level reporting, as well as statements from government officials. Each state is a little different. Many states make it easy to compile the data at the county level with well-formatted and complete data, but others don't have infrastructure in place. For California, rather than consulting the state website, which hasn't offered complete information, we consult in the 58 counties instead. In Texas, where the data reported at state level has been well behind county reports, we've checked as many of the 254 counties in that state as possible. The way New York and New Jersey report their data requires us to go down to the county level to find the number of COVID-19 deaths. In all cases, if the state data leads to questions or is incomplete, we go down as close to the state source as possible. Our nation has more than 3,000 counties, which means potentially more than 3,000 data standards and places to check in order to verify and collect data on a daily basis. While we haven't gotten to that point where we actively check with all 3,000 plus counties, we know that's always a possibility given the need for us to source reliable and geographically specific data. The manual-only process can take up to a full day to gather and report information. We repeat that every day. We've been able to automate much of our basic updates, which has allowed us to focus both on data integrity and to go down further to local level agencies that may be lagging behind in reporting directly to their states. We've taken steps to make this even easier by building scrapers to get the data directly from state level websites. However, in the long run, the easiest way to collect this information is to get all government sources to agree, not only on what needs to be reported publicly, but also how it's reported. We've settled on two metrics by which to measure the extent of the virus: cases and deaths. There are several more we'd like to report in this manner, such as hospitalizations, testing, and demographics. While many localities have been good about reporting this data, it's not universal, forcing us to limit our scope. Additionally, if localities reporting the data, they all have different ways of doing so. But we are doing what we can every day, collecting the data, publishing, then turning around and doing it all over again the next day, because we know that this information is critical to everyone on the front lines of the virus. From individuals to organizations, the data is helping people make human security decisions. We've mobilized to provide this information because decision-making should be driven by data and evidence, not by adjectives and assumptions. We hope you will use it. This information is helpful for everyone who wants access to real-time, nonpartisan, digestible data, from the engaged citizen to the public servant to journalists. We're seeing an unprecedented spike in our traffic from individuals, these engaged citizens looking to understand how the spread of the disease is impacting their community and how it compares to other areas in the country, specifically with diagnosed cases and deaths. People are asking other questions too, though, such as, what's the economic impact? Will I be eligible for government payments? What will my payment be? What's the impact on my local healthcare system? The data we've been putting out helps people understand where the disease is spreading most quickly and how quickly, and the counties most at risk. Looking from a geographic perspective helps people understand their level of risk on operating business or continuing to go to work. We're also looking at food insecurity. Who's eligible for payments the government is making? How many hospital beds are available? And helping people understand how the virus impacts their community, how it can impact their health, and how it can impact their quality of life. Much of this pandemic comes down to the individual and the opportunity we all have to protect and advocate for our futures. Organizations are also using data to make critical decisions that have broad impact on the country. We're seeing our work being used on a broader scale by organizations who have critical decisions to make that have a larger impact on the trajectory of the country. I'll give you a few examples. West Point Academy is using our data in a GIS-based dashboard to provide situational awareness on hotspots tied to the location of cadets, faculty, staff, and prep school cadet locations. This provides an interactive platform for leadership to fly around the world and the states to see the distribution of the people and the virus. Kaiser Permanente is using our data to forecast for surge planning and to map high-risk areas. Walmart is using our data to plan for drive-through coronavirus testing sites. Feeding America to plan for food support. Bank of America, Rite Aid, and Tyson's Food to estimate closures and risks to their businesses. Mike Bloomberg to share this critical information via his social channels. We're working with the CDC, who's using our data as a benchmark to check other data against. The list goes on and on. As humans, everyone's security is threatened right now. Our goal is that through data, you will be able to understand how best to respond to the human security threat you are tasked with, and to understand more broadly how this pandemic affects personal health and the resulting impact of that. Income insecurity, mental health during times of isolation, access to food, and how this is devastating our most marginalized and vulnerable communities. In times like these, in every time, the facts deserve to be heard. Please use the facts to continue to have productive, data-driven conversations and making educated decisions that can help save lives. It's our honor to do work that not only allows our country's shareholders, like you, to get access to the facts, but also the world more broadly so we can collectively understand the data and advocate for change with it. Having access to data helps people make decisions and propose solutions. On any normal day, those decisions can inform how people advocate for better schools and safer communities or who they vote for. During a crisis like this one we're experiencing today, those decisions become critical. Sometimes they're even life or death. Our job is to offer individuals the information they need to take care of themselves and their families, and to give those on the front lines fighting COVID-19, that includes you, what is needed in order to have productive, data-driven conversations and make educated decisions that can help save lives. Thank you. I'd now like to introduce today's panel moderator, Dr. Scott Weiner, a founding board member of the Hay Institute, who also teaches political science at the George Washington University. Scott?
Thank you so much, Poppy, and thank you everyone for joining us for today's panel. I hope you're all doing well amidst social isolation and hanging in there. We just heard Poppy discuss the issue of data and the aggregation of local and national and even international efforts. So on our panel today, what we'd like to focus on is talking about how a global pandemic can be understood by looking at each of these three levels. We see a global pandemic here at the Hay Institute as a perfect example of a human security challenge. There isn't really a threat to borders or traditional security elements, and yet there is a massive crisis going on. So the human security paradigm really helps us to wrap our heads around a lot of these issues. To help us do that today, we have a fantastic panel assembled for you. To talk about the local level, we have Jacinth Brown, who is the Chief Impact Officer at DC Central Kitchen here in Washington, D.C. At the national level, we have Colleen Creighton, one of the advisors to the Hay Institute, but also the CEO of the American Association of Suicidology, which is co-sponsoring today's panel. And then to give us the international perspective, we have Mara Pillinger, who is a policy manager at the O'Neill Institute for National and Global Health Law. So at each of these three levels, the COVID-19 pandemic is having an important impact, and understanding the ways in which these levels are integrated can help drive us towards an effective policy intervention. So Jacinth, just to start with you here in Washington, D.C., what is DC Central Kitchen doing to assist people in the district during this time, and what are its top priorities at the moment?
Thank you again, Scott, for having me on. Once again, everyone, my name is Jacinth Brown. I work for DC Central Kitchen, and I have been there a very impressive 2.5 months. So there's nothing like joining a new organization and then facing a global pandemic as soon as you walk through the door. So DC Central Kitchen, just to give a little bit of background and history for those that might not be completely familiar with it. It was founded by Robert Egger in 1989. DC Central Kitchen is a local nonprofit in Washington, D.C. that focuses on fighting hunger by building a healthier, more equitable, and more prosperous community. We strive to conquer 4 core issues: fighting hunger. We do that by providing meals to local homeless shelters, school meals and summer feeding sites, and providing fresh food options to local corner stores. We provide healthy food access by serving more than 1 million locally sourced, scratch-cooked, healthy meals to low-income students at 15 DC schools annually, providing fresh, healthy food options to 70 corner stores in DC's food deserts, and providing a new market for area farmers by operating DC's only permanent food hub and using our purchasing power to bring locally sourced healthy food to more DC communities. We also educate our community through healthy food demonstrations and educational materials. We decrease food waste. The United States wastes about 40% of its food supply each year, but 48 million people struggle to put food on the table each day. At DC Central Kitchen, we take on the issue of food waste by using 3,000 pounds of surplus food and ugly produce to prepare 5,000 healthy meals for our community each day. We tackle unemployment and poverty. Income inequality in DC has remained one of the highest among large US cities for nearly a decade. We know that food alone won't solve hunger in the long run because hunger is a symptom of poverty. That's why we train at-risk adults for culinary careers and use each of our programs to create good jobs for people leaving hunger behind. DC Central Kitchen targets the issues of chronic unemployment, intergenerational poverty, and recidivism with a 14-week culinary job training program for at-risk men and women with histories of incarceration, addiction, homelessness, and trauma. We also have a culinary program for at-risk youth, ages 18 to 24. And it also is similar to our job training program, which helps them to learn both the front of the house and the back of the house to have meaningful careers in cafes and restaurants. So to be more specific about our response around the COVID-19 pandemic, in addition to all of the offerings that I just spoke about, we're also operating to-go meal sites for DC youth at 5 DC public schools. A lot of states in the country offer summer meal sites for their students throughout the summer. What DC has done is also implement the summer meal sites now, and DC Central Kitchen helps to feed 5 of those sites. We are operating 9 mobile feeding locations, serving to-go breakfast and lunches through our partnerships with local nonprofits, faith communities, and the Office of the State Superintendent of Education, which serves as our state education agency. We are increasing meal deliveries to local shelters and nonprofit agencies, including an additional 450 meals per day. And that number continues to grow each and every day as we have our morning check-ins to shelters that are remaining open during the daytime hours. In addition to our 5,000 meals, it's important to speak to the fact that many of the shelters traditionally would close during the daytime hours, and now they're operating 24 hours a day. We're providing those meals. We're continuing to deliver fresh produce and healthy snacks to our corner stores through our Healthy Corners program, and are now announcing a price cut of up to 50% on our already discounted fresh whole fruits and vegetables. This is in an effort to provide fresh food options to those areas in the District of Columbia that are considered food deserts. We are also providing fresh produce bags to our culinary job training program students and staff looking for additional support while at home. We're also providing these fresh produce bags to the community feeding sites. And finally, we're supporting the Ward 7 COVID-19 response team, a grassroots mutual aid effort by providing 200 daily meals to older adults facing food insecurity. And I will stop there.
Great. Quite a lot to digest. Really see the organization. We know that there are organizations like this across the United States who are engaged in this kind of aid. So to take things up to that national level, I'll turn to Colleen, who works on not just the physical health side of the pandemic, but also the mental health side as well. And so I'll ask you, Colleen, what do policy practitioners need to keep in mind about mental health during the pandemic? And what kinds of policies should they be including as they plan out a comprehensive response?
First of all, is what's the status of crisis services here in the United States? Obviously, our first concern, and we've been working on this pretty much every day for the past couple of weeks, is that how many more people are in need? What does the call volume look like to our crisis centers? Who is calling? What do they need? And we just we had a survey that we put out this morning, and we're trying to get that information. But if you look across the board, the interesting thing that we found is those calls to the National Lifeline have been pretty steady. One of the things that people are, suicidal ideation isn't first and foremost in what people are calling in on, but anxiety numbers are increasing. But one of the things you realize, especially as we all move to a more tech-friendly platforms and get a lot more dependent on technology, there are more calls to the disaster distressed helpline. So those call volumes are going up. And again, anxiety is first and foremost. But one of the things we found interesting is in talking to Crisis Text Line this morning, their call volume or their text volume is up significantly. So you have increases. This morning, they noted 47 to 116% increases depending on the day. And 1 in 5 texters specifically mentioned coronavirus. So I think what we're doing is kind of matching that with all of our partners and saying, what do people need right now? But I think we're seeing trends in telemedicine. Right now in the policy, that there are a lot of restrictions. We're trying to work with legislators to get those restrictions released. so that therapists, clinicians can see patients via, as we're talking now. We also have to keep in consideration peer recovery specialists. So we just signed on to a letter this morning, kind of removing some of the restrictions and increased funding for peer specialists. Especially right now, what people are needing is typically in-person meetings such as AA, other recovery eating disorder groups, things where they just need their peers. They no longer have that access. And while I love technology, there is that human element that's missing. And so a lot of it at the federal level, we need some of the restrictions, we need more funding, access to ways that they can communicate. So those are some of the immediate ones that we're tracking.
Stan, I think you're on mute.
I'm going to take myself off mute and try this again. Thank you. What I was thinking is, Colleen is speaking to a national level issue that many other countries have experienced. And so moving to the international level, I wanted to ask Mara what the state is of the global pandemic. Where are we in terms of the global curve? And what are international institutions like the World Health Organization, the UN, and others doing at the moment to try to move the global community through the current pandemic?
Sure. So the pandemic is in very different stages in different parts of the world. Overall, like 200 countries, just a little more than 200 countries are reporting cases. So that is basically everywhere. And we have about 1 million cases globally and approximately 50,000 deaths. But in Asia, where it started, things look like they're largely under control, at least for the first wave. And so what countries like China are worried about now is really what happens when they lift the restrictions and if they have imported cases kind of coming back and seeding new epidemics. In Europe and in the US, Italy and maybe Spain have appeared to kind of turn the corner, but everywhere else we're still really heading into the thick of the storm. And then in the global health, based on the data that we have, we're still on the precipice. It hasn't really hit fully there yet. Although it's very likely that there are cases that are going undetected, and we will begin to see this change in the next few weeks. And at the international level, I mean, WHO, which is an organization that often comes in for a lot of criticism, has been doing a remarkable job in trying to lead and to coordinate the global response here. And I think one of the things that is challenging is, as a global organization that is trying to address a pandemic that is in such different states, different parts of the world, right? To give advice to countries that are in very different places in terms of their healthcare capacity, income level, resources. So there's a challenge of trying to address a pandemic that really does require, as we've heard from the previous panelists, an intensely local response. To try to speak to 200 national or 200 local responses is challenging. And then on the multilateral level beyond WHO, I think we're really seeing the multilateral institutions and the global community still starting to get back together in terms of coordinating a global response. There's been talking and planning going on at the G20 and the UN Assembly. There has been about $1 trillion of funding available through multilateral organizations, but still a very long way to go in terms of really translating some of that talking and planning into meaning.
So the COVID-19 pandemic has kind of captured the world's attention as the major problem, but of course there were many other political issues going on prior to the outbreak of the pandemic. And so the pre-existing conditions on the ground, both literally in terms of individual health, but also politically, have really shaped the way that the pandemic is playing out in a political sense. So for Dissent, I wanted to ask, how does food insecurity here in DC, but maybe in other similar communities, how does food insecurity exacerbate the issues that arise with the pandemic?
Yeah, thanks for that. So to answer the question, and paint a better picture, we'd have to first talk about food insecurity without a pandemic in the District of Columbia. So what we know is 92,000 children and adults are struggling to feed themselves every day. In 2015, nearly 30% of DC households with children reported not having enough money to buy food. Across the nation, as many as 48 million people are food insecure. So we take all that information on a normal day and we add a pandemic on top of that. And during this pandemic, and I believe it was Colleen that talked about this a little earlier, people are advised and often ordered to stay at home, right? So with this limitation, gaining access to food sources can prove to be difficult and often nearly impossible. For example, the public transportation system is limited. And here in the District of Columbia, delivery services are limited. And for those who are immune compromised, just going out in the public might not even be an option at all for them. So what happens then if people don't have access to healthy food because of the pandemic? NIH has done, studies about this. Like I said, Colleen talked about this. And what happens is, for example, food for children result in illness in adulthood, such as diabetes, hypertension, mental health concerns, just to name a few. For children, food insecurity during a pandemic can increase their probability of these health concerns and have more immediate effects, such as learning deficiencies, what we consider, they're not getting their brain food. It can also have mental health concerns, such as depression, anxiety, hyperactivity, and aggression. For adults, what we can see is food insecurity can have some of those similar effects, but are often more immediate. Underlying health concerns are heightened when proper nutrition isn't obtained. In addition, health effects are seen faster as parents are forced to eat less because they're prioritizing their children for food access. Finally, we look at elderly adults. They're amongst those who are at the highest risk during a pandemic for all the reasons that adults and children have. But what we have to add to the elderly list is many of them live alone. There are great organizations such as DC Central Kitchen and other partners out there, such as Martha's Table and the Food Bank, who've added to feeding and helping to feed some of these adults who live alone. But they're having difficulty getting to some of these feeding sites. So those who live alone don't always have access to options outside of the feeding sites, such as the door-to-door delivery systems for various reasons. Let's talk about financially, the burden that places on them. Even with some meal delivery discounts, there's still an additional cost for a lot of elderly adults, and that's just not always in the budget. So dealing with an underlying issue of poverty and food insecurity on a day-to-day, actually in the District of Columbia, is always an issue. It's an issue that we're facing and we're trying to fight each day at DC Central Kitchen. And then we add the global pandemic with all of the limitations that are offered with it. And you just add a different level of the need for food and the lack of being able to access it. So those are just some of the things that we're seeing in the community of the District of Columbia. And I'm sure it's not unique to DC. Our neighboring states, of course, Maryland is also reporting some of these same issues, Virginia as well, who both have similar stay-at-home orders as the District of Columbia does. And I'm sure my colleagues will back what's happening on the national level with this as well.
That's exactly where I'd actually like to go in the conversation to ask Colleen if some of the underlying anxieties that existed before the pandemic are exacerbating some of the anxieties that people are facing.
Absolutely, but I think how many more stressors have just been added to individuals' lives? So you have food insecurity, you have poverty, you have social isolation. You don't see your friends and peer support that you have anymore. You may have lost your job, so you added now a whole economic level of disparity. And there's a lot of great studies out there that show increased suicidal ideation with economic factors and things of that nature. So I think right now you have everything, like everyone has noted that, you have everything coming together at one time, which is frightening for us. So I think it's not one aspect of this. I think we have to look at this from the holistic group. One of the things that we've been recommending, and I know there's a local center here in Virginia that is specifically talking about the elderly and the older population that maybe can't get out, is we still have communication. Whether they can text is a question, but I mean, you could pick up the phone and still call somebody and check in on somebody. And some of the centers here have a program called Caring, which in addition to maybe food delivery, they'll also just call once a week and say, hey, how are you? So that's one of the things that we've been talking to our membership about, is just take a minute to reach out to somebody. Let them know that, we're all going through this together, but we are in this together. And just because you don't have physical contact with somebody anymore, still check in with one another.
And Mara, this is sort of the very American perspective that we have. I'm sure it's very similar to other countries and their experiences. What might people not realize about the pandemic based on reporting here in the United States and the way that the average American is experiencing the pandemic here in the US?
Sure. So, I mean, I think it really goes to what Poppy was saying earlier about the challenges of gathering accurate data. And there's another facet of that, which is even with the best data being reported by states and counties and by countries, we really don't know what the pandemic looks like. It is the classic tip of the iceberg problem, where we see only the cases that we're testing for. And in the US and elsewhere in the world, well, not everywhere in the world, but in most parts of the world, the testing strategy is still really narrow, where because we're concerned about shortages and the efficient use of resources, we're really testing people with known exposures, especially in the States still. And that means that we are always one step behind the virus, right? And there's data that we're getting from other parts of the world where they have tested more widely, including Iceland, where they tested their entire population, that suggests that somewhere 30 to 50% of cases may be asymptomatic, still spreading the virus, but without presenting symptoms, therefore not going and getting tested themselves. And so we're missing this whole piece of it, right? We're missing people who are walking around who are sick, who don't know it, who are spreading it, who don't know it. In Italy, they have identified 111,000 cases through testing, but they suspect that the number of people infected might be as high as 6 million. The Wall Street Journal, I think, just reported that the other day. So as much as we're tracking the numbers and paying attention to the maps and paying attention to the case reports, we have to realize that we're still missing most of what is going on with this epidemic.
So Jacinth, your position as the Chief Impact Officer involves a lot of trying to assess these metrics to plan policy interventions. So how do you navigate some of the problems of having imperfect data and leveraging that data for successful interventions with DC Central Kitchen?
Yeah, great question. So once again, there's no better way to become acclimated in a new role at an organization than to have an entire global pandemic to happen 2 months after you start. So to that end, quantitative and qualitative data is like the bread and butter of how I make every move each day in response to designing successful programs during the COVID-19 pandemic. Just some very specific examples of things that we do. Each day we huddle as an organization to review all of the numbers of meals that were distributed the day before. We analyze this data to make projections of the increase of meals needed or the decrease of meals in an effort to prevent food waste. And when you hear decrease in meals, like, well, what's going on there? We're just one of many local nonprofits in the District of Columbia fighting, to provide food access to those in need. So if there's an area where there's another nonprofit, we typically work with that nonprofit so that we're having more of a greater impact on that specific community. We use this real-time data to drive programmatic changes and to assess the financial need of the organization to ensure that we're leveraging our partners in a meaningful way. Once again, that whole looking at the other partners in the communities that is also doing similar work and different work. One thing, we are a food hub. So when there's several donations, for example, the convention center had to shut down, of course, by the order of the mayor. All of their food, came to us. We were able to prep it and prepare it and get it out there to the other partners in the community to make sure that they're distributing food out, and just using the data to see how that's going, and to see how we can leverage our partners and funding to ensure that once those supplies decrease or maybe even dry up, because remember, we're still in the thick of things, how can we make sure that there's a continuous source of food coming in through DC Central Kitchen to make sure that we're getting it out there to our partners. Our delivery drivers, you think of a delivery driver, they pick up, they deliver, right? No, not at all. They're having that safe contact with the community each and every day. So they're providing quantitative data around the community needs so that we can equip them with the appropriate meals necessary for each feeding site. In addition, they provide extremely helpful and relative qualitative data so that we have a pulse on how the community feels about the quality of the food. We don't want to just push food out there. We want to make sure that they're eating healthy food, nutritious food, that is quality food, and that we're providing the items that they feel are needed for their families. One example of this is our grocery bags that we provide to the community. Many of the residents, they're extremely grateful because like I mentioned before, transportation is limited. We're an urban city. People depend on public transportation for everything. We don't even have traditional school buses in DC. Our kids take public transportation. So that should identify the need and the importance of our public transportation system. With this pandemic, transportation is very limited at this point. There was a young lady who missed the bus at the schedule. The next one wasn't scheduled to come, for a very long time, and she needed to feed her family at that moment. We showed up in the community with those fresh fruits and vegetables, and she was very grateful to have that type of access to meals. And they even share the recipes that they're preparing with their families. While it seems like, minimal data, what I do as a Chief Impact Officer is I take that information to say, okay, these are communities that have multiple families living within one home, many generations living in one home. The bus system there is running maybe once, twice per day. How can we increase the nutritional value and increase the groceries and product that we can move into the neighborhood so that if there's a situation where they're not able to get to that public transportation on time, that the family is stable for 1 or 2 days, until we can get back out into the community. So we're using data in a very real way like that to make sure that we are just providing as much nutritional possibilities to each and every one of the communities as we possibly can. And just really focusing on that and on a programmatic level. Unfortunately, our culinary job training program had to stop for the moment, of course, because we can't, gather in classrooms at this time. But what we've done is we've collected a lot of data about what type of technology and access that they have, what needs they may have. And what we've done is connected them to a lot of virtual classrooms and virtual resources, and some things in our wait, because I'm going to address a lot of other issues that we found with our students and some of the community that we're finding clever ways to address based off of data that we received, not just from national surveys or what we're researching, but real-time data that we're actually getting from delivery drivers on the streets, food distributors, collection centers and donations. We're really collecting that real-time data every day and using it each and every morning to make sure that we're planning for the community and their specific needs.
The common theme that I hear in a lot of these programs is connection, bringing people together and matching resources to the people who need them. So I wonder, Colleen, if there are ways that for people who are involved in doing that, whether it's at a formal level as part of an NGO or a mutual aid society, or even just volunteering to do a grocery run for people who are at risk, if there are ways that people can sort of integrate some of the mental health aspects and recommendations to help facilitate mental health at this time when we're all sort of holed up in our apartments or houses because of social isolation.
Absolutely. So there's a couple of different ways. First and foremost, I think know how to have the conversation. And there's a lot of different places where you can find that information, whether it's our website, suicidology.org. the National Suicide Prevention Lifeline. They have some tips for, checking in on folks and what to say, what not to say, because messaging is really key and important. I think what's also important too, look at New York City. How many clinicians, in addition to all the medical health providers, the mental health providers that stepped up and are volunteering their time, whether they're checking in, whether they're offering sessions. A lot of the clinicians are transferring their practice to Zoom and other related platforms. So I think a lot of the clinicians, there's an opportunity. You can check in with your local crisis center. We have over 700 crisis centers around the country. If you have any questions, we have information on our website where they are, or if not, send me an email and I can easily connect you with your local one. I think the other thing that we're checking in too is one of the things that's concerning to us is if you look at the increase in gun sales across the country, that's one of the things we flagged. So we've been reaching out to like Brady and some of the other groups. I think when they pulled the numbers, there was about a 300% increase. According to the FBI's National Crime Information Center, background checks processed on March 16th increased by 300% over the same day comparative to last year. Now, if you look at what that means, typically in a lot of studies, if you have a gun in a domestic situation where maybe now you're self-isolating, you're in a house, if you have the presence of a gun in a domestic violence situation, that increases the rate of homicide by about 500%. Children accidentally getting into guns and things like that. So there's a lot of factors that we're concerned about, and we're just monitoring to kind of connect people. Number one, I would say the crisis centers are the key constant resource, whether now or as the future. Because again, I want to remind, once the stay-at-home and all these regulations lift and you're able to go back out into the community, there's a lot of after effects, I think, that we're going to be hit with that we're trying to prepare for now. Because I think a lot of like the economic situation, the poverty, the food insecurities and things like that, that's not just everything, whether it's a date on the calendar, June 10th for Virginia, here where I live. I think those are some factors that are going to, again, get us involved. We need to get involved with to kind of have a plan for.
So I want to invite those of you who are listening in to submit questions in the chat windows. So it's over on the right side of the screen, and we'll try and integrate those into our conversation. So Mara, we're having a question about one of the important political events probably in our lifetimes, and yet as fellow political scientists, I don't think any of this has to do with our sort of intro to IR questions of security or borders or militaries. This is a very different conversation. So my question is, how do traditional security approaches fall short when it comes to dealing with a pandemic, and what are some better kind of high-level ways that we can start strategizing a response to the pandemic?
Yeah, no, it's so true. I mean, if you think about our traditional security theories, whether that's realism or neoliberalism, whatever else, right? These are theories that are developed in the context of and developed to kind of help us understand conflicts among nations, where it's another country that is the enemy or the competitor, and where we think about whether we are safe or not safe as a national unit. And yet, as you said in your introduction, like a pandemic is sort of the quintessential scenario for a human security approach, because with a pandemic, the unit that we have to think about securing is an individual, the human body, right? The enemy is a virus, and the battlefield is our bodies and our immune systems. And so we can't keep ourselves safe as a national unit. We tried that. We tried the travel restrictions. We tried sealing the borders, and it doesn't work, because if you can't, see the virus and you don't know where it is, then you can't keep it out. And so ultimately for this, the end game will be a vaccine. And there again, the thinking about this as a national problem, we wind up selling ourselves short, because a vaccine can't be developed alone either. You need researchers and data and clinical trials and funding and manufacturing capacity from all over the world working in concert to make this happen. And so I think that the promise for how we should be thinking about this is to embrace approaches that really have us thinking about this in terms of conceptualizing it as a global problem and conceptualizing a global response. And we are seeing some of that. We're also seeing some more nationalistic responses where countries are talking about preventing the exportation of drugs, of medical devices, even of food. And, on the one level, this kind of look to your own response is very understandable. It's very much comprehensible. But on the other hand, it is counterproductive to encourage isolationism and nationalism and fragmentation when the truth is that this is a problem that no country can beat on its own.
I think maybe just to add to that, it seems like there's also not just differentials of power between countries in terms of who has resources and who doesn't, but even within countries among different populations. And especially here in Washington, D.C., we know that there is extensive systemic inequality that existed even before the outbreak of the pandemic. So for Dissent, in terms of your experience at DC Central Kitchen or DC Central Kitchen generally, how are things like race, class, gender, sexual orientation, other marginalizing identities impacting how people in the district are experiencing the pandemic or experiencing that intersection of food insecurity and the public health crisis?
Yeah, Scott, this is a loaded question. I could literally write a 20-page paper on this question alone. But just to tackle a couple of areas around this. So before COVID-19, the average household income of the top 5% of DC residents was about 52 times the income of the bottom 20%. In the third quarter of 2015, our unemployment rate amongst African Americans in DC was about 13%, more than 5 times the unemployment rate for white DC residents. So many residents have already lost wages due to closures and stay-at-home orders. African Americans are projected to experience increased unemployment and lost wages due to the already existing gaps in the city. So that's a whole different situation. So for those who are experiencing homelessness in DC, and also housing insecurity, they're at a greater risk of exposure to COVID-19 as well. While shelters here are taking every precaution that they possibly can to reduce the risk, shelters were already overcrowded in DC. So making the 6 feet spacing requirement, it's extremely difficult, to maintain at a shelter. Families who are doubled up or youth who are couch surfing, it's extremely difficult, to decrease their potential risk, because they're bouncing from home to home, or there's more than 10 people, in one home, and maybe some of those 10 people, 1 or 2 of them are essential employees. So they are out in the work space during the daytime and home in the evenings, with their overcrowded homes as already. Finally, there's individuals who are experiencing substance abuse and mental health issues. And like I said, my colleague Colleen hit the nail on this. And these are some of the things we're also seeing at DC Central Kitchen with some of our former students and our current students. Many organizations are moving to online support groups, meeting face-to-face, and, online support groups in lieu of face-to-face. We're also one of those organizations that is trying to do that. Just something special about, the human touch and the human element piece of this. And it's just not as effective, doing these support groups online. It also speaks true to those needing therapy and other mental health services. The COVID-19 pandemic has created trauma and could possibly trigger those with mental health and behavioral health concerns, but can also create new ones. So we're seeing multiple, groups that are being marginalized because of this. And even with potential effort at DC Central Kitchen, and that, many of, our colleagues out there are doing around the world to try to, combat this, there's still, like Colleen mentioned, this after COVID-19 that's going to be happening. And when you already have marginalized groups, on a normal day, what is then the result, of COVID-19 on these already existing marginalized groups?
Just to follow up on that, to ask whether DC Central Kitchen has interacted with communities who are the targets of misinformation about the virus or its origins, or who is more susceptible than others, and whether that's affecting how people are experiencing the pandemic here in DC.
I'm sorry, it was beeping when you first started the question. Can you repeat that for me? It's because I pushed my button.
Sure. So are there groups in DC that are the targets of misinformation or discrimination about the virus in terms of that it originates in certain communities, or people in certain communities are more or less susceptible to it?
Yeah, so I'll speak to some of the groups that I spoke about, specifically our residents who are experiencing homelessness. So they're always a target of misinformation. So, for example, they'll see a homeless individual, walking down the street. Unfortunately, they're suffering from some sort of other chronic illness, possibly, and there's some coughing involved or whatever else. All of a sudden, it's, oh, that person absolutely, has COVID-19. They're already, stigmatizing them with being addicted to, drugs, mental illness, everything else, without even, interacting with the person at all. So they typically are the main ones with the groups that we see and that we serve, that are absolutely have information and perception during the COVID-19. In addition, some of our groups, and I'll say, I love our law enforcement out there. I'm actually married to a cop, so I'll say that before I make this statement. They'll see, those individuals walking down the street, or congregating, in huddles, and there's these stay-at-home orders, and the 6 feet no contact and everything, and those things are put in place for great reasons, But when you're dealing with facing housing instability, when you're dealing with facing homelessness, sometimes on the street corner, and it may not be a once they part ways, they're on their own. That may be their only time for human touch at that point. So there's this, perception of, they're helping to, the disease, different things going on. And like I said, I'm condoning gathering in any groups. God knows I'm not. But at the same time, there is a lot of stigmatism around individuals who are facing homelessness. And the District of Columbia has had around this piece to address some of the issues is that if a individual who is facing homelessness or housing insecurity is showing symptoms of the COVID-19 virus or has tested positive already, there are medical facilities that are quarantine facilities that the city has created. There's professional medical staff there. There's also mental health and substance use specialists that are there to provide that care while they're in quarantine, to help aid them through the sickness and to also prevent the spread of the disease in homeless shelters.
Colleen, I see you not. Is there a similar trend that you've seen that the mental health effects of the pandemic have targeted specific communities, particularly marginalized communities?
Definitely think, and I love that point about it not being that easy of an issue, especially with congregating in different groups like that. We have to remember, if I had one kind of dream for all this, would be to stop thinking in such silos, because I think we're guilty of thinking like, say it's a mental health issue or an economic issue or something like that. There's a lot of factors at play. So I think in a lot of cases, that person may be outside because maybe home is not a safe place. They may need to leave the house for their own security. And so that's, I guess, conceptually you get into the issue of, I understand you may be congregating in a group of 4 or 5 people. Understand, I'm not condoning that, but there are factors at play. So I guess even with the media, even with just when we're putting messaging out there, to remember that right now we're all living in kind of a messy situation, and there may be a blueprint, with here's what you follow, steps 1 through Z. But I think we all have to be a little more compassionate in addressing the issue and realize that everyone's going through this at the same time, number one, but everybody's bringing a different struggle to this issue as well. So I think if we could all be, number one, a little more compassionate and realizing it's a lot bigger of an issue. There's a lot more factors at play than we even are understanding now.
So Mara, there's a lot of nuance that's been laid on the table by both Dissent and Colleen with regards to the local complexities and the ways that local politics are shaping how the pandemic plays out. How are global institutes taking into account local actors in their recommendations, and how flexible are the recommendations of international organizations responding to the crisis?
It's really good. Good question. I think it's, as I mentioned earlier, there's something of a struggle for organizations that are trying to simultaneously give recommendations to the whole world at once, to also give recommendations that are intensely responsive to local nuance and local contexts. So I think that what global organizations try to do, like WHO tries to do when they issue these recommendations, is to lay out a benchline or to establish what best we know from a scientific perspective. And so when you see WHO come out and recommend, testing, increasing testing capacity as much as we possibly can, like crazy, and then trying to take steps to help make that possible across countries, there's a reason that the level of advice is kind of pitched at this high level the way it is, and then it is left up to federal to local governments to figure out how to adapt that to be responsive to their populations and their contexts. So the best that international organizations can do is to offer guidance, and to try to offer guidance that is as comprehensive as possible, and that helps to flag what all of these different considerations for balancing are. So you've seen WHO talk a lot about being conscious of the mental health implications of social distancing, and really try to emphasize that we're talking about physical distancing. We're not talking about social distancing. Don't distance yourself from your friends and your family and your communities that need your support. Just do it virtually. So there's an awareness of that, and a challenge to try to make sure that we're not prioritizing one issue, one set of challenges, one set of threats, one difficulty above all others, even as the intention of the whole world is intensely focused on this one virus and this one thing as a challenge.
One of the questions that just came in relates to the importance of education and the fact that across the globe, students aren't going to school. So there aren't graduations, but their job prospects may suffer, maybe long-term economic impacts. Is that something that international organizations are taking into account, even if just that high kind of top line?
Yeah, they are. I mean, we saw a study come out from UNESCO that was trying to document, how many people are out of school worldwide, and something that you see with international organizations, with the UN system, because they are issue specific, is that you kind of get this fragmentation of analysis coming out. So WHO is focused on the health piece, and you'll have to look at UNESCO for the education piece, or look at the bank or the IMF for the economic piece. And I'm intensely guilty of this as well, in that I am a public health and global health person, and so I don't know the education data off the top of my head. But again, I think you sort of have this specialized advice coming out from all of these organizations trying to provide as much information or context on all of these problems as they can. And then it is, as we've been talking about through this whole webinar, it is the local level where the rubber meets the road, and that's where all of these streams and strands come together. And policymakers have to figure out how to adjust and balance all of the pieces in a way that meets the holistic needs of their communities.
There are a lot of different pieces and a lot of different institutions that are working through them. So you have governments, both kind of national and local, nonprofit organizations, the private sector, et cetera. So Jacinth, you work now in an NGO, you previously worked in the BC government. How can all of these different entities, this kind of ecosystem of entities, best coordinate to provide a maximum response to the pandemic?
Yeah, sure. So, I've had experience both in local government and, of course, now in the nonprofit sector. And what I'll say is DC Central Kitchen has always and will continue to do a great job at partnering with all of these entities and serving as the community kitchen in the District of Columbia. To that end, we're going to continue feeding the community through our government contracts, which those help support our schools and our community feeding sites that I spoke of previously, our nonprofit contracts, which supports our shelters and several of our other feeding sites. and serving as the hub for food deliveries and prep for our fellow partners in the community who are nonprofits that are doing similar work. Our government, our nonprofit, and our private sectors, they can help by partnering with organizations such as DC Central Kitchen and other organizations doing similar work to provide, financial assistance, whether that's monetary via a grant or even something as simple as a gift card that we can get out there to the community. They can provide fresh food items, such as, if you're connected with a local farm or another food source, you can provide produce or shelf-stable products. And one big thing, which we haven't had a chance to talk about today, is sanitation items. Everyone is looking for masks and disinfecting items. We work in a kitchen and we feed, push out 5,000 meals, every day. We have to wear masks. Throughout, stop in order to, try to decrease, the spread. So these are some things that are absolutely needed. One unique private venture that we have, which I just kind of wanted to mention today, I've been pushing this whole, healthy food piece, and, we're going to continue to push that. But, we're not prudes. With an organization, Pizza Paradiso, to do a mobile pizza kitchen at our feeding sites, just to kind of bring the community together. We're going to make sure we keep the, 6-foot distance, allow, our families to come and participate in learning how to make pizzas, out there in the community, and enjoy a pizza, every now and then. As like I said before, deliveries are limited, in the district at this point. So there's various ways that you can partner with different agencies. I definitely have to push for all those that are listening out there, and I'll reiterate this later. One huge partnership that I want to encourage everyone, and this is on the private sector, is to support restaurants and restaurant owners. As soon as the dust settles and for us, some of the first places that we need to go out is to support the restaurants. Right now, they are hurting. They're going to be hurting later. They are one of our major partners that we use to help in poverty, in our program and in the District of Columbia by providing our culinary students there. So just make sure that you're going to support your local restaurant.
Colleen, a similar question for you. Are there things that the NGO sector or the private sector, or even we as individuals, can do to help support that mental health aspect of things during the pandemic?
Well, yeah, and I think what's a little disheartening, I think, is we wish, and I guess conceptually you think we'd be a lot more coordinated now than we are, but there's a lot of great models happening right now that I think after this is over, we'll be able to turn to. But I think right now local is key. So definitely reaching out to the local food bank, reaching out to the local crisis center. They need to know what's happening. But I think a lot of it starts in the community too. There's a lot of really cool stuff happening with green and red placards in windows. And I think little simple things that you can take as an individual, where some of the elderly neighbors are putting, a red placard or a green placard in their window to say, hey, I need some help or assistance, because they can't venture outside. You're seeing supermarkets now turn over a couple of hours in the morning just to those that may need additional precautions when shopping. And again, I think just checking in on one another is going to be key, and reaching out to those local agencies. Blood donation is a huge one right now. It is still safe to give blood. But people are still afraid. And so I think, and maybe this is my call to maybe working with media a little bit more too, is making sure, don't just put out messaging for the sake of getting your messaging out, kind of coordinate and see what others are doing as well. I think from us, it's confusing. If you want to find out just basic information, you have to sift through so many different sources. You're getting mixed messaging across the boards. Even the governors aren't aligned with what should be done at this time too. So I think right now, just as an individual, start reaching out to your own community, see if your neighbors need help, and then start reaching out to those entities providing the services that are missing. One of the things that we're doing too is checking in on colleges too, because the concern about students, we just had the case of the Air Force Academy. So the Air Force Academy lost 2 of their senior cadets within a period of like 3 days. And if you saw what happened, because they were nervous about the social isolation between kind of having connections, so there were repercussions of if they broke protocol, if they were meeting in groups of more than 10, if they were not social distancing. And then they had everybody go to individual rooms within the academy. And what they realized after the death, they relaxed that and realized that the cadets could go outside academy grounds. Cadets could meet with their friends as long as they took precautions. So I think we're still in this kind of everyone feeling out the next best approach. But again, if we can kind of slow things down a little bit, meet with one another, check in on each other, I think that could help tremendously.
Mara, looking at a global level, what are the long-term prospects for the pandemic? Do you see this as something that will happen in kind of one big wave? Is that sort of idea of a summer lull and then things coming back in the fall likely to happen? Can you say anything about kind of how international organizations are projecting the remainder of the pandemic to play out?
Yeah, I want to be really careful here because the honest answer is we don't know. There's discussion about the potential of a summer lull. At the same time, we've seen transmission in areas that have, Singapore, weather all year round is a lot like our weather in DC in the summer, miserably hot and humid, and the virus is spreading there. So, I want to be really careful. The challenging thing and a little bit depressing thing to say is that ultimately things won't go back to normal from a health perspective until most people, so maybe about 60% of the population, is either immune to the virus because they've had it and they've gotten better, or because we have a vaccine. The timeline for the vaccine, I'm sure you've all heard, is 12 to 18 months, best case scenario. Vaccines take a long time. The lockdown measures that we have now, obviously, we can't sustain this for 18 months, right? So the purpose of these measures right now is to buy us time. It's to buy us time to prepare ourselves to treat people who are sick by scaling up hospital capacity, identifying drugs, and then to try to implement as widespread testing as we can right now to be able to identify and isolate people who are sick and break the chain of transmission. Because if we don't do that now, then as soon as we start to lift the restrictions, transmission starts again and we're back to where we started. So one key tool that we're really close to having, it's been developed and is serologic testing, antibody testing. So tests to detect whether people have ever been infected, not whether they're currently sick, which is what a diagnostic test does. And once we have this in wide rollout, we will be able to identify people who are already immune. And this is important for those individuals because they can go back to going to work and go shopping for other people and all of that stuff. It's safer for them to be out and around. And also because it helps us know on a population level, how close are we to that 60% number? How close are we to being able to sort of ease up on these restrictions with confidence that we're not going to suffer from a second wave? And so that's sort of what we're waiting on right now.
Waiting seems to be the theme for a lot of us as we're kind of sitting, holed up, waiting for things to pass, trying to stay socially isolated, and there's a sense of restlessness about what we as individuals can do. So just and for us here in DC or for people in other communities across the US or across the world, how can people help and assist the work that DC Central Kitchen is doing, or help with similar organizations either here in the district or across the country or around the world?
Yeah, there's a couple of things. Of course, mine is donate. As always, financial donations to DC Central Kitchen and local organizations is the single best way to help with operations when it comes down to feeding individuals. For that, of course, people can go to our website, dccentralkitchen.org, to donate online. I also encourage you all to look at your local organizations that are out. Donate to them. The other thing is to just elevate and spread the word about what DC Central Kitchen and your local organizations are doing in response to the crisis to make sure that we're combating food insecurity. Include the specific needs for resources and supplies. I talked about a couple of those supplies earlier. For us, you can find the information, of course, on our website and our social media pages, at DCCK for Twitter and at DC Central Kitchen on Instagram, and locally. Once again, if you go and Google your local COVID-19 response, you can see those organizations that have their specific web pages as well. And just share, spread the word so that people who are in need of those services might just see it on your page. Finally, I can't stress enough, please support the restaurant industry. Our restaurant partners are an integral part of our work and our mission to fight hunger and to end generational poverty. And drive-throughs open or pickup options open. Please go out safely and patronize those restaurants. When this crisis is over, our partners are going to be instrumental in providing job opportunities to our culinary job training students, our youth cafe learners, and not just specifically DC Central Kitchen, but the community at large. The hospitality industry is always one of those industries that is hiring. Lots of people are going to be looking for employment once this is over. If we can support our restaurant industry and our hospitality industries now, we can set them up for those jobs that were lost during this time.
Colleen, a similar question to you. Are there things that individuals can do? You'd mentioned calling people who are living alone to check in on them, not just about their physical health, but about their mental health as well. Other steps that we as individuals can take to help have that positive impact on mental health at this time.
Yeah, and I think first, I'm guessing that most people don't even know that where their local crisis center is. So number one, I think my call to action would be find out your local center. And reach out and see what they need, because a lot of times they're staffed by volunteers. So whether it's simple as buying food, or whether it's donating money, whether it's helping them out with whatever they need, it would really be to support your local crisis center. And again, check in with one another. Reach out to someone you haven't heard from. If you see something that someone posts that maybe is concerning, let them know the numbers for crisis text line. Let them know the number to the National Suicide Prevention Lifeline. Feel free to ask, how are you feeling? But I also think too is take care of yourself. I think is foremost that we really didn't touch on is that your own mental health, make sure that you're taking self-care, turn the TV off. The constant barrage of just negative news and concern and anxiety, step outside, turn the TV off, do something that you find relaxing. So I think definitely take care of yourself and take care of everyone around you. But also, we talked about thanking restaurant owners, support local businesses, but also thank healthcare workers too for, and first responders and everyone that is out there. They're not able to stay home with their families. They're putting their own lives on the line in some cases, and just show compassion for each other again.
Mara, thinking about this at the global scale, what is the balance between the impact that these individual actions that we've heard laid out that can have on the pandemic and kind of balancing that against the role of international organizations and governments and how effective they are? Is it heavily weighted towards governments? Is it something that really individuals have a key role in solving? Does it take a partnership between them? How would you kind of assess the balance between those two kind of sides of the coin?
As with all things, it's a partnership between them, but this starts with the individual. I said before that, ultimately this is about like person versus virus, and that's true, right? And so what stops transmission is people changing their behavior as much as they can in a way that prevents transmission. And right now, unfortunately, I think we've seen with the stay-at-home measures, as necessary as they are, and they absolutely are, but it feels like the burden is really falling mostly on individuals, right? We've seen everyone's lives have suddenly been arrested, and yet, and the government is kind of coordinating that. But I think we've been slower to see the uptick in production of ventilators, the uptick in making sure that personal protective equipment is available to our healthcare workers, not just to doctors, but to nurses and the people who are cleaning hospitals and, everyone who is out on the front lines of this. Slower than we would like to see corporations stepping up to protect their workers who are delivering packages for us and delivering food for us. You know, and we saw sort of in the US the package to try to mitigate some of the economic harms for people, but so much more to be done on that front. And so if we're asking people to upend their lives, to adjust their behaviors to protect not only themselves, but everybody else, then it is the responsibility of our governments at the local, at the state, especially at the federal level here in the US, at the national level in other countries, to step in and to try to balance that out by providing the help where it's needed. And because international organizations are not themselves governors, right? They're associations of states. The best that they can do is provide data, to provide advice, to remind everyone, you know, to remind everyone of the importance of having a broad picture of what the cross-social implications of this are going to be, and to try to share information about what can be done to mitigate those effects. But that's not something that a global organization can do. It has to be done by our federal and state and local governments.
We laid a lot of issues out on the table today, a lot of obviously very concerning issues, but I hope that this panel has been an opportunity to see that there are so many individuals who are doing such incredible work, whether it is at the local level or the national level or the international level, and that inspires you to stick with the measures that are in place and to continue to follow the event closely as the pandemic plays out. I just want to give our panelists a minute or two to share any final thoughts with us before we take Colleen's advice and close our screens and maybe spend some nice time outside in the sun. So we'll start with you, Jacinth.
So I'm coming off mute. Yeah, thank you. Just finally, I appreciate the opportunity to talk about, you know, an issue such as food insecurity and just things that people aren't thinking through because we're, you know, so worried about, of course, our own lives, our own self, and protecting ourselves and our family. Just having an opportunity to talk about how we can all band together to assist some of our vulnerable, you know, community members and some vulnerable residents, you know, around us that may not have the same opportunity as we do to take care of themselves. I appreciate a platform like this to be able to do that, and just agree, you know, with the call to action to see how you can make a difference by tapping into some of the resources and programs that are already doing this work out there. So just encourage everyone to continue to move forward with that.
Thank you. Colleen?
And not wait until after all the stay-at-home verdicts release. You can do a lot of things now. You can make a tremendous impact in your own community now. But I also want to say thank you, Scott and High Institute, for putting this together. As part of the advisory board, I'm really excited to kind of see all the energy being brought to being timely and getting information out as needed. And I'm really excited to see what's awaiting in the next couple of months too.
Thank you. Mara, we'll give you the last word for today's panel.
I wanted to kind of highlight the international, cross-national research efforts that are going on. Incredible collaboration from the international level, from WHO, down through the local level, through research labs, donors and funders, and some drug companies to identify treatments, to develop vaccines, to do the research that we need to beat this. We've seen an absolutely unprecedented level of international collaboration around this. And ultimately that will be the light at the end of the tunnel, is going to be a vaccine. So there's a model for us from the research community of how we can work together from a local to an international level to make that happen.
If you'd like to find out more about all of our panelists, you can check out our website, thehighinstitute.org, where you can also find information about other panels that we create to facilitate this conversation around human security, both here in DC and other cities across the United States and internationally. On behalf of the High Institute, I'd like to thank you all so much for joining us today. Stay safe and have a wonderful afternoon.